The following is produced by 5 Star Productions USA, which is solely responsible for its editorial content.
It may be a small world after all, but if you're short-statured, many dreams can seem out of reach. What can be done to help children grow? The results from a stress test could help save your life, but if you can't exercise, how can you take the test? Even among Hall of Famers, Lou Gehrig is a legend, but a deadly disease struck him out in his prime. What is Lou Gehrig's disease, and why is there more hope now than ever before? Join us today on Today's Health.
Human growth may seem like one of the miracles of life, but it's actually a very explainable biological process. Reaching your adult size involves many factors, including the actions of certain hormones. But what happens if your body doesn't produce enough growth hormone? Hello, I'm Faith Daniels. Welcome to another edition of Today's Health. Why are some people tall and some people short? There's no simple answer because so many factors affect human growth. However, sometimes the key is in the hormones.
In about 18 years, an average person will grow from a fertilized egg just a few millimeters wide to a fully developed male or female human, generally over 5 feet tall. Understanding what causes that growth may give us the key to unlocking it in cases where it's less than normal.
The most rapid growth occurs during fetal life before birth. The child at birth is about 30% roughly of adult height. At 1 year of age, 40%, and at 2 years of age, 50%. The genetic factors come into play during the first year generally. Pattern shifts more to what is genetically predetermined.
Probably the most significant predictor of final height is the average height of the child's parents. To get this estimate, calculate the average of the two parents. For a male, add 13 centimeters. For a female, subtract 13.
We can look at an x-ray of the hand and wrist and see that calcium becomes deposited in what was cartilage. And as this happens, there is more maturation of the bones and eventually closure of this growth plate, so that when the closure is completed, growth stops.
If for some reason a child is not producing enough growth hormone or the system is not reacting to it, the growth will be significantly slower than the normal rate.
All short children are not growth hormone deficient. Once we determine that there is deficiency, we generally give a pretty much standard dose of growth hormone, and then depending on the response, we may or may not increase the growth hormone dose.
The final height of a child is something we don't have much control over. However, for children to grow to their full potential, they must be in good health. If you're a parent, you can help by making sure their growing bodies get proper nutrition, exercise, and sleep.
When a child is diagnosed with a growth hormone deficiency, parents and doctors sometimes have the option of treating the condition with growth hormone. In order to make an informed decision, though, it's important that parents understand the therapy and the issues surrounding it.
When he went into kindergarten was when it really became noticeable. We saw him with kids his own age, and at that time he was about 10 to 12 inches below the average, which is a lot when you're only 3.5 feet tall.
Being short can be a fact of life or a consequence of biology. For children who have a growth hormone deficiency, therapy exists that can help trigger their own biological growing response.
There is replacement therapy available once the diagnosis of growth hormone deficiency has been made. At this time, has to be given by injection.
In some children, this may enable them to attain their full height potential.
With the treatment, it's estimated to be another 5 years. And especially now that he's approaching puberty, that will change.
Growth hormone therapy is a long-term treatment that lasts over several years. It can be expensive, and health insurers can have strict qualifications for coverage.
Testing is difficult in terms of determining whether a child is growth hormone deficient. We like measurements over a 6-month to 1 year or more period to determine whether the child is growing adequately for the time that elapses.
And one of the first tests is a blood test that they check on the thyroid gland. And then another test that they give is called a stress test. After that, they give an MRI to rule out any tumors.
And often we will do an x-ray of the hands and wrist to look at the maturation of the bones. If a child is growth hormone deficient and does not receive replacement therapy, the adult height is likely to be in the range of 4 to 4.5 feet. The number of inches that a child on therapy will grow depend a lot on his genetic potential, the age that he's diagnosed, and the age that treatment is started.
The risks of side effects and the benefits of the treatment should always be discussed with the doctor.
Well, we debated about it quite often. I gave him an option. I said, you either have to deal with your growth and not growing, or you get the treatment and you will grow.
Since short stature cannot always be medically treated, some children will grow at a slower rate than the norms. Many experts advise that parents and others deal with these children according to their psychological maturity and not their physical size.
Stay with us on Today's Health.
While some children are experiencing growing pains, others are pained because they're not growing. For many of these kids, growth hormones may help them reach their full potential. But for others, short stature is simply a fact of life. It's important that all children understand it's no crime to be short.
A lot of the kids tended to treat him as a little brother, because he looked like he was 2 or 3 years younger than the kids he was in class with, even though he was the same age. We also noticed that people started to ask if him and his brother were twins, and yet his brother is 4 years younger. So that was another sign that, he was very far behind in terms of growth.
Kids teased me. They usually called me shrimp or baby or tiny or something like that. It made me very mad when they called me names.
It's not always easy being short, especially when you're a child. In addition to being the source of cruel names and other forms of ridicule, short stature can sometimes make a child feel that many dreams are out of reach.
I wanted to be taller so kids wouldn't make fun of my size anymore, so I can actually reach stuff.
I think our society puts a lot of emphasis on height. And we're not just doing it so he can be tall to make the basketball team. We could care less about that. I just want him to grow as best as he possibly can.
A child who has been diagnosed as having growth hormone deficiency can be helped to get through this psychologically by being treated his age, not to talk down to him like he's actually younger than he really is.
Now, since I'm pretty much the average height, nobody even notices that I have this growth disorder.
It may seem hard to believe in this day and age, but the choice to put a child on growth hormone therapy is often dictated by gender. About 4,000 to 5,000 new patients are started on the therapy each year, and about 70% are male.
I would say that there are definitely more boys than girls brought in for short stature. This is probably something to do with society's expectations that men should be taller than women.
There was a time period he didn't want to get the shot, which it is shots that is the method of treatment.
I think the idea of injections is difficult for both parents and children.
Therapy and shots is definitely worth going through all of it.
What is normal? Children and adults often stigmatize others who deviate from the norm. For children with growth hormone deficiency, their difference is a physical challenge, not a personal choice. Therapy that can promote growth may hold potential for both physical and psychological benefits.
Logging on the internet may actually be good for your health, especially if you visit our Today's Health homepage at www.bstar.com. You can get more information on any subject we cover, and there are even some extras waiting for you. Can you pass a stress test? Doctors often use exercise stress testing to prepare patients for an imaging process that can identify coronary artery disease. But many times, patients at risk can't do the necessary exercise. So how can doctors make a diagnosis when patients can't perform the test?
What's your risk for a heart attack? It could be higher than you think due to coronary artery disease. It accounts for nearly 1.5 million heart attacks every year. Nearly 40% of those strike with no warning.
Coronary artery disease is the #1 killer in the United States and annually takes over 500,000 lives.
Coronary artery disease is a blockage in the blood vessels that supply blood and oxygen to the heart muscle. In people who cannot exercise or where the cardiogram is abnormal, we really need to get additional information by actually getting pictures of the blood flow to the heart. And the way we do that is by exercising, and when they reach their peak exercise level, we inject them with a very small amount of low radiation that will give us pictures of the blood flow to the heart and allow us to take images or pictures of the heart, and it'll tell us whether there's blockages in the blood vessels or not.
A stress test can be a very effective way to spot a problem due to coronary artery disease before it can trigger a heart attack. But what happens when a patient is in poor physical condition, has arthritis, or suffers another condition that prevents the exercise necessary to properly dilate the arteries?
There's a large number of people who cannot exercise. So in these types of patients, we need to somehow create a stimulus or a stress to the heart. We use several pharmacologic agents. One of them is adenosine, and the way adenosine works, it causes the smooth muscles that surround the blood vessels to the heart to relax. And when these vessels relax, there's a great increase in blood flow, about 4 times over the amount of blood flow that you see when the patient is resting. An intravenous catheter is put into a vein in the arm, and the drug is infused. The patient does not have to exercise. He merely lays on a hospital bed. We then get pictures of the blood flow to the heart using a special gamma camera. From these pictures, we can make a decision as to whether the person has blockages in the blood vessels to the heart. And we can also make some decision as to whether this type of lesion in the coronary blood vessels needs to undergo coronary artery bypass surgery, or whether the patient can merely be placed on medications. It has a very short half-life, so that when we stop the infusion of the drug, the dilation of the blood vessels reverses and the patients go back to their normal state in a very short time period.
In terms of our health, coronary artery disease can be regarded as public enemy #1. Therapies that can help doctors take full advantage of defensive procedures may help us put a net around the nation's leading killer.
Stay with us on Today's Health.
In 1939, Lou Gehrig played his 2,130th consecutive baseball game. In 1941, at the age of 37, he died of amyotrophic lateral sclerosis, Lou Gehrig's disease. 56 years later, his record was finally broken, but the disease that bears his name still remains a mystery.
No one had more stamina than Lou Gehrig, the Iron Horse. His Major League Baseball record for consecutive games played stood unchallenged for over 50 years. But there was one opponent he couldn't beat, ALS. Amyotrophic lateral sclerosis, also known as Lou Gehrig's disease, is a fatal neurodegenerative disease that attacks specialized nerve cells called motor neurons, which control the movement of voluntary muscles. At any time in the United States, about 25,000 to 30,000 people have ALS. The disease progressively robs them of their ability to move, eat, and even breathe. Patients generally survive only 3 to 5 years after diagnosis, but some live much longer.
I mean, I didn't deny that I had it. It's just that, now what? That part of it I was denying. You know, what am I going to, you know, how am I going to handle it? So it's sort of like in a little static limbo there for a while. It's terminal.
Well, there are many theories, and there have been over the years very many theories of the cause of ALS. And you can guarantee that if there are many theories, you really don't know what causes it. Well, ALS is a disease that affects very specific cells in the nervous system, progressively causes them to die, to degenerate, and produces problems in the patient that are the results of the death of those nerve cells, while sparing all the other functions of the body. The brain, the mind, the control of your bodily functions, sensation, all remain intact.
ALS can strike anybody between the ages of 20 to 90. Genetic factors have been identified as a probable cause in only 10% of all cases. The tendency of the disease, however, is to afflict people over the age of 50.
There's no specific blood test, and that is one of the great difficulties with regard to the diagnosis of the condition. Nobody who is a doctor really wants to make a diagnosis of ALS in somebody because it has a bad prognosis.
Physically, it's affected my hands and my arms, and I am able to do just about none of the things that I used to be able to do, so it's very frustrating to deal with the physical aspects of it. Well, my hopes for my future and the future solutions for ALS are that the many recent discoveries would come to fruition.
As yet, there is no cure for ALS. But now, compared with 3 years ago, there is some treatment which undoubtedly slows down the progression of ALS.
Most people are not very aware of Lou Gehrig's disease. It can strike and kill quickly, and families are often preoccupied with helping their loved one rather than crusading for attention. But as awareness grows, so does the research effort, and ultimately, the hope for a cure.
In 1995, Cal Ripken Jr. finally broke Lou Gehrig's consecutive game record and then commemorated the event by creating the Cal Ripken Jr. Lou Gehrig Fund for Neuromuscular Research. The Iron Horse filled the book with records, but inspiring the search for a cure for ALS may be his biggest highlight.
The race is on. At first look, a pharmaceutical laboratory may not appear to be full of heart-pounding action, but these researchers are literally racing time in an effort to find the elusive formula that can stop a killer, ALS. Since the disease was identified over 125 years ago, ALS has baffled doctors and researchers. But now, we may be closer to a breakthrough.
Neurological diseases are now really the last frontier with regard to diseases that we have to get on top of and cure. So the need for neurological research is undoubted, and there is never enough money for research. In terms of medication, the FDA approved the release of the first drug that is effective in slowing down the disease. It's a drug called riluzole. It's an anti-glutamate. Now, glutamate is a simple amino acid, but it's used by the nervous system to transmit impulses from one nerve cell to the next nerve cell. If there is too much glutamate, then that will overexcite the nerve cells. In the end, that will make them wear out faster, and that will produce, therefore, nerve cell death. It's a drug that blocks the effect of glutamate on the nerve cells. It doesn't completely abolish it, but it certainly decreases the effect. And that has been proven to slow down the progression of the disease.
Currently, a patient's brightest hope is that the disease can be staved off long enough for a miracle to happen. That's not always enough to get you through the day, but attitude is important. One study indicated that patients with a more positive outlook survived significantly longer.
There are patients who fight the disease and seem somehow to survive longer and do better than those who just turn up their toes and say, there's no point in trying.
It's very uplifting to be in a family situation. I am in a program, which is a trial. So as a family, we have certainly stood up and worked together and faced this thing.
The hope lies in research, and the hope lies in the discoveries from that research. And this is now beginning at last to manifest itself.
My hope is that everyone's consciousness can focus not just on certainly ALS, but all of these unfortunate diseases.
People with ALS may feel like they're in the bottom of the ninth with 2 outs, but hopefully the spirit of the great Lou Gehrig can inspire them, because the next hit may start a rally, and as another great Yankee once said, it ain't over till it's over.
It doesn't matter if you're a small child or a larger-than-life baseball legend. The most important treasure any of us can have is good health. Without it, fortunes have no meaning, and with it, there's nothing that can hold you down. For more information about any topic covered on our show, visit our internet website at www.vstar.com. I'm Faith Daniels. Join us again next time as we get right to the heart of matters affecting your life on Today's Health.
This has been a presentation of 5 Star Productions USA, which is solely responsible for its editorial content.